I'm going to spend the next 25 minutes talking to you about safer sharps. Safer sharps and NHS supply chain, the link is, some people have questioned. We work in partnership with Health and Safety Exec and the Royal College of Nursing. Health and Safety Exec, as many of you are aware, are launching something called the Safer Sharps. The consultation document's been out and has recently been brought back in. The actual guidance will be issued in January for implementation in May. So over this agenda, we're going to guide you through the process of what Safer Sharps is about and how to implement that, both from a tailored change management, staff engagement, how to deal with the change, and then how to make sure the change is maintained. So if we look around the purpose of the directive is not around patient safety, it's around staff safety. There's 100,000 needle sticks estimated to take place in nurses every single year. 48% of nurses in an RCN study have been affected by needle stick injury. I have been one of those nurses. But it's not just nurses, it's about everybody who works in a hospital, from cleaners to catering staff to porters. This is something that the directive aims to reduce happening. Everybody knows how horrific it is to actually experience that needle stick yourself and not know where the needles come from and have to go through the whole process. This directive's about reducing the harm that not just needle sticks but the whole sharps injury can happen. A trust is estimated to spend £500,000 every single year in just dealing with the consequences of a needle stick injury. A lot of people just think needle stick and the Safer Sharps Health and Safety Directive is going to apply to NHS. It's not. It's going to apply to everybody. It's going to cover care homes, social care providers, anybody who's providing care to the NHS, it's going to cover. So what exactly is going to be covered in the HSE directive? Until they actually launch it in January, we don't know. We've been supported in the education and the implementation programme. So we can say to you just now, it's going to cover anything that's classified as a sharp. So that includes scalpel blades, it includes trocars, cannulas, diabetic needles, the whole remit. Anything that's classified as a sharp will be included, even down to fetal blood testing. You need to comply to the regulations. However, you don't need to move everything to a safer sharp product. It's about actually tailoring what you need to do with a comprehensive risk assessment. So it's not just about we need to move everything over and everything needs to be moved over by May. It's about understanding from your perspective in a trust who it impacts, what it impacts. If that product is used once a year and it's never got a needle stick injury, it's got an education plan around it, put it on a risk register if you don't have a sharp alternative to it. A recent example that we found is a trust who was fined £20,000 from the HSE for a needle stick that caused that worker to contract Hep C. We've understood the directive and we've briefly summarised exactly what the directive's going to be setting out to achieve. So we know what it's happening, we know why it's happening, we know it's going to protect the staff, it's not about patients. However, how are we going to manage the change? If you think about actually the number of sharps that are in a hospital at the moment, from theatre packs to phlebotomy units, everything, it is huge scale change across the NHS. What you really need to do is have a tailored clinical management. So it's all about a change management that's tailored to the trust and to the individuals within that trust. I'm not going to teach people how to suck eggs. I'm not going to patronise people by telling you exactly what a hospital says and how healthcare settings are extremely unique and challenging. We've been there. We know how difficult it is to deal with patients, but clinical staff are equipped to deal with change. That's what we do. Our patient's condition changes, our care plan changes. We can deal with that, but what we can't deal with is the unknown and not having the products that you need to do at the time you need them. So if you look at tailored change management, NHS Supply Chain, and the reason that the RCN and Health and Safety Executive partnered with us is because we're healthcare professionals. The people who are coming in and working with your trust are clinicians, they're nurses, they're specialist IT people with interests in healthcare. It's not about a one-size generic solution from an accountant firm who thinks it can save you money. This isn't about saving money, this is about saving staff. We understand the complexities, we have been there, so it's about working with you to tailor what you need, ensuring you've got appropriate risk assessment and providing you with the enablers as a trust to ensure that you've got the education, you've got the implementation and everything is designed to complement what you need to ensure that you're compliant. The compliance date for the Safer Sharps is May the 11th, 2013. So if we're going to change things, and things are going to be changed within a trust, the most important people within that trust are the staff. The biggest asset that any employer ever has is the staff, and nothing more can be truer than in a healthcare environment. If we think about the percentage of change management programmes that are actually successful, and this is just across the UK, there's 30% of any change management programme that's actually successful. That means 70% of change management programmes will actually fail. Safer Sharps doesn't have a failure. There is no option for us to fail in implementing a Safer Sharp policy. If you have assessed the risk as you need to move to a safer product and it's not suitable to be placed on a risk register, you will have to have an implementation plan in place. You'll have to move across to something that is compliant. To make sure things are successful and to make sure things stick, it's all about the staff, especially on this one. We're not rationalising, we're not cutting costs, we're not cutting corners, we're protecting the staff. So this is personal to every single person in this room, otherwise you wouldn't be on this conference. To engage the staff and take them on a whole-scale change process that is going to involve them learning new practices, treating patients differently. It's going to mean that the practices and techniques that they've used day and daily, that they have become very adept at and very inept at, will have to change. The process that Supply Chain have worked together with the Royal College of Nursing and Health and Safety Executive to do is actually ensure that we provide you with the sections to enable you to do that. So it's making sure that the staff are on board, the staff are fully engaged and the staff fully support what it's doing. If people understand why they're doing it and if people understand change, they're more likely to be involved in it and they're more likely to be supportive. Rather than a nurse on a night shift being told that they can't take blood using a needle and syringe anymore, they need to use a different set. The question will be why. So it's about enabling and making sure that your staff are engaged and fully bought on to what's happening. Once you get to the engagement and you've got your staff bought into the process, it's about understanding that the change will need to then happen and it's about implementing that change. There's different ways you can implement it and there's different methodologies. Supply Chain have a methodology called the MAKE. That's a methodology that comes from our parent company DHL. We are not a product company. We don't sell products, we do solutions. So we're not about actually, here's a product for you and this is the only product you'll use. It's actually, you have a problem, so let's make something happen. Now, whether that's DHL moving a Formula 1 car or hosting London Fashion Week, or whether it's Supply Chain kitting out a new MRI scanner or a new intensive care unit, it's about you come to us with a problem and we will help you find the solution and work through in a controlled and structured methodology. So we look at when it comes to the time for change. As I've touched on briefly, it's not about actually you have to change everything. It's about considering what you need to change, understanding the implications, the patient, the benefit and the risk. If you need to change something because the risk assessment has identified that, engage with the stakeholders, ensure there's a critical path, get the alignment in place and work with somebody who has the experience in healthcare change. Supply chain has a support structure and a whole implementation team there designed to make sure that this change goes as smoothly for you and your trusts. Once we've changed it, it's about maintaining it, because it's quite easy to change a product. You just change the purchase route, you change the stock that's on the shelf. But how do you make that product stick? How do you make sure that the staff, instead of taking 2 minutes to draw a blood sample, initially they're probably going to take 5 because the technique's changed? It's that whole one-handed technique that we're all probably quite good at. However, safer products, you might need 2 hands. You might actually need to take that little bit more time to understand what you're doing. And it's also about educating the patient to say, this is what's happening, there's new products and techniques in place. And as part of that, you might experience a little longer wait when you're going for your routine warfarin check. Maintaining change is really important. There's no start and there is a start, there's not an end, sorry. And once you've actually chosen the product and got the product on the shelf, that's really the start of the change. I understand that this is a really brief, top level understanding of the health and safety exec and what we can do to change. From an organisation, from a company perspective, there's a whole implementation toolkit out there to do it. It's about giving you the enablers and giving you the options to pick up the elements that you want. So if your trust already has a strong change management process in place, but they have a pure communication process, then if you work with supply chain and the RCN and the HSE, we can give you the elements that's lacking to make sure your change programme's successful. So we look at what supply chain are doing. It's about in partnership with you, and it's about tailoring to you. It's about your needs, not ours. So it's about giving you the tools and the support that you need from the specialists that are able to do it. So the clinical team are able to come in and do the clinical part with you. We've got implementation team who can actually organise to make sure that when you've got one set of products coming in, that you're not having 2 on the shelf. Because if you actually consider the fact that there will be times where there'll be safer products and non-compliant products on your shelf, and it's about managing that whole education process and mitigating the risk to both the staff and the patient. Change is what our business does best. I've stressed it throughout the brief presentation. It's about solutions. It's about supporting you and delivering that. There are workshop days run throughout December, and there's going to be some set up for January, which will allow you to see all the new products that are out there, that allow you to see the scalpels, the needles, the syringes, everything that's there and everything that you're going to be available to change. You might be using one current system at the moment because you like it. However, the product will change when it becomes a safety product, and the way that that product is used will change. Maybe the fact that you can't fit it in one hand any longer because it's become bigger. So it's all about understanding that. These workshops are designed for you to hear from the health and safety exec on their audit, so you can actually hear from the people who have written the legislation and the directive. Around the RCN, about practical guidelines for the clinical staff, and more around the implementation structure and the make process that supply chain can put behind it to support it. If you've got any questions, the clinical team are on the stand outside. Most of these have probably spoken to them already today. For us, as supply chain and HSE and RCN, it's about a partnership. And it's about partnership with the trust to ensure that we deliver the processes that you need. Any questions?
I have no questions.